forward. So welcome to IGOT Communities today. We are with one of our specialists. We're with Donald Zebraski of True Choice. True Choice is one of our premier partners. And so welcome, Dawn. Thanks for joining us, and thanks for helping us to create videos that our members can use all year long. So welcome.
Well, thank you so much for having me, and it's a pleasure to be here, and hope that we can share some information that will help people gain better understanding and knowledge of Medicare and the options and the abilities that are out there for them to cover their health needs throughout their Medicare years.
So I know that currently, of course, it's January the 26th, and we're in the early month of OEP, or open enrollment period. But I just want you to give us some points about Medicare, and particularly open enrollment, and any other thing that you would like to share with us today.
Sure. And so, we all know that the annual enrollment period that's in October. It's October 15th to December 7th. That's the open annual period where people can change plans. And so many people get fixated on that and realize that there are other opportunities to change throughout the year. And January is one of the January, February, March. The open enrollment period is the greatest opportunity that outside of the annual enrollment period. So many people get bombarded during the annual enrollment period and overwhelmed with the calls and the people that they decide, what, I just don't want to change. I'm just going to stay. And then they find themselves that we've gone into another year and I'm still compromising. I'm still getting less of the benefits than what I'm looking for. I'm still looking for more of this or more of that. And so this annual, the open enrollment period that runs every year from January 1st to March 31st, is that great opportunity. It's a one-time change that people on a Medicare Advantage plan can take advantage of. So it's not for the person with original Medicare, that's been on Medicare for a couple of years and now they decide they want a Medicare Advantage. It's not going to work for that. It's not for the person who has a Medicare supplement and a prescription plan, and I want to shop around for prescription plans. This is not the time for that. That's the annual enrollment period in October through December. But this time of year, if you've got your Medicare Advantage plan and you found out too late that your doctor has left the network, or God forbid you find out that the agent told you the doctor's in the network and they're not in the network, this is a one-time chance for people with Medicare Advantage plans to really review what they're doing with their health care and to see, because you're able to change Medicare Advantage plans. You're allowed to leave and go to a Medicare supplement if you can make it through underwriting, or if you happen to be in a state that has guaranteed issue. But for the most part, this is an opportunity for people on Medicare Advantage plans to change plans.
Yeah. So I know that if you just, like you said, if you have original Medicare, you can't start shopping now. That was back in those months, October through December. I do know that if you have a Medicare Advantage plan and for some reason you felt the need to go back to original Medicare, you can do that during this period.
Yes. So all the changes are based on the precept that you have a Medicare Advantage plan now. So as long as you're starting with the Medicare Advantage plan, as a matter of fact, it's not just called the open enrollment period, it's called the Medicare Advantage open enrollment period. So all changes are based on, I currently have a Medicare Advantage plan. I can, 1, change Medicare Advantage plans, 2, leave my Medicare Advantage plan and go to original Medicare and a prescription drug plan, maybe a supplement if you can make the underwriting for that.
Yeah. Okay. Thanks. And I think the big question is that people that I hear have is, can I make a change? And when can I make a change?
All right. And so changes are available through this period, anywhere between January 1st and March 31st. And the change would go into effect the start of the following month. So any changes made between January 1st and January 31st are for a February 1st start date. Anything made February 1st through February 28th or for a March 1st start date. And then from March 1st through March 31st, those changes would be effective April 1st. Again, it is limited to, you can make one change, and Medicare does track that. They are aware when you utilize your Medicare open enrollment period, and don't, it's not like the annual enrollment period where you can change your mind each time. Once it is allocated, that you've used that special enrollment period, it is gone. You cannot make other changes.
Okay. Okay. So let's say they've used their one change, and then later on in the year, are there other times or reasons or that people can make changes?
Sure, and there's a list of, they call them special enrollment periods, and many of them revolve around either government assistance or change in address or residency. So if you move, you obviously are going to have that opportunity to change the plan, because Medicare Advantage plans are based on a service area where you live. So you've got that option for you to, if you move, to be able to change plans. If you're receiving not only Medicaid, Medicaid is a great feature out there by the states that allow assistance for people with low income, but they've got levels of government assistance through the Social Security called the Extra Help Program. This is a great program. As a matter of fact, there are millions of Americans that qualify for this benefit program that don't even know of it. And when you look at the high cost of medications in this country, and when you realize that there are at least 5 million Americans that are eligible for a program that would cap their cost at $9.20 per month, or even for $9.20 for a 90-day supply. It's a great thing, and really more people should be taking advantage of that and using what's really available to them. It's not a handout program. It's something they've worked hard. They've earned, paid into their Social Security throughout their lifetime, and the government realizes that the cost of living has gone up beyond what they were making in their working years. And so this is something that's made available. It's not something that's to be looked down as a handout program. It's something that's really there as a lift up to make sure that people are not struggling financially to use their, to purchase their medications. Nobody should have to decide between, should I get my medications or my food? So they have these programs in place for that.
So it's just called extra benefits or extra help?
Extra help or low income subsidy.
Okay. Now, can you walk us through how you get that? What's the process?
Sure, and I've got a
And
paper
who
here.
helps with that? Is that something that the senior does by themselves? Is it something that you help them do? Is it something that we would do help with IGOT communities help them do? How exactly do we do that?
Sure. So there's lots of options for it. One, it's right available on Medicare.gov or through Social Security, actually socialsecurity.gov/prescription help. They've got online applications. But listen, here at True Choice, we're so much more than just trying to sell the plan. We're here to help our customers. And so, yeah, do I get any recognition for helping someone with extra help? No, there's nothing for us as an agency that is financially rewarding for helping it, but it's more than a financial reward when you see someone that's in need and you help them through it. So any of the agents here at True Choice would be happy to assist with an extra help application. When you do an extra help application on the, we just go right to the website, ssa.gov/prescription help, and we complete the application. And there's a part where you say your relationship to them. And as a licensed healthcare agent in their state, we're able to put down that we're an advocate assisting them, on their behalf. So we have that relationship and able to assist anyone that's looking for extra help, regardless of whether they were enrolling in a plan. Because certainly we've got lots of options. When we talk about this Medicare Advantage plan, open enrollment period being an opportunity to change plans, at True Choice, we're we're not ones looking to guide you to one plan. So many companies out there, they want to show up and talk to you about the plan that they've got for sale. Well, you and I both know that there's not one plan that's a perfect fit for everybody.
Exactly.
That in order to have the right plan for each person, you've got to have lots of plans. That's why at True Choice, we've gone beyond trying to bring one plan to the customers. We're representing strategic partners with Anthem and Aetna and Cigna and Humana and United and WellCare and Allwell, Mutual of Omaha. So just across the board, we want to bring options and variety to the customers. And because there's going to be something that's going to fit someone's needs. One of the great things about having so many options is you get a partner on the phone, someone that you can trust, because chances are that whatever plan you're on, I'm already representing. And so if I'm talking to someone on the phone, I've got nothing to lose in talking to a customer and treating them fairly, treating them with respect, and giving them a fair assessment of their plan. Because worst case scenario is their plan is better than any other plan that I'm offering, but I'm already featuring that plan as one of my options. And so I turn around and say, well, it looks like you've got a great plan. Why don't you go out and tell your friends how great that plan is, and I can help get them enrolled in that plan. So one, even my people I'm not able to help, I'm able to ask for referrals because we go beyond that one stop. We're more of like a one-stop thing where we can, you can look at many options through us. Again, that comes to play with, the people with extra help. When we review it, when we help somebody and go back, I want to come back to the extra help. When we go back and help someone with that, we know that we've got options, and we want to present the options and what's out there. You asked specifically about extra help, and I've got a little cheat sheet here for that. Extra help, I bring that down to two questions that I have to ask people to determine whether or not they make extra help. And the application's more involved, but it's as simple as this. There's two questions: income and assets. For a single person, is your income less than $19,140 a year? Married couple, $25,860. Those numbers will change in March when the government puts out the new federal poverty level. It's based on a percentage of the federal poverty level. And then the assets are hard numbers as well. And so what do they consider an asset? Asset is any investments, real estate that you're not living in. So an investment property. So it doesn't include your home, your vehicles, your personal possessions, life insurance, burial plots, irrevocable burial contracts, or back payments from Social Security. But an asset level for an individual person is $14,610. And for a couple, it's $29,160. So if your assets are below those levels and your income is below those levels, you're going to qualify.
So I have a question there. So sure. Let's say that your income was 17,000 and you're an individual, but by chance, you had 20,000 in a 401k.
So it will not qualify for the extra help level. It is. For the extra. As a matter of fact, I've seen a lot of agents through the years that, it has a hard stop on it when you're doing the application. The hard stop comes on the assets. So the 14,610 is a hard stop for an individual. The income levels, the system would look at it, but those are the real numbers. The 19,140. What comes to play is that single person that's not married that may be taking care of a grandchild and have custody of a grandchild. That even though it's saying one person, if there's another dependent on there or a disabled child that you're taking care of, that's not a spouse, the income level would fluctuate, but the asset level is still going to be fixed.
Mm-hmm. Okay. And that's good to know, because lots of people have those questions.
Sure.
So, yeah. Um, any other just general information that
I have a question.
yes.
Sure.
You mentioned earlier something that happens often, especially during AEP and OEP, as members find out that their plan that they had, or the doctor that was in the plan that they had is no longer in the network, or the networks have changed due to contracts that the carriers work out with the providers and facilities. Correct. So,
Right.
what would you say to those folks that find out, or they're looking for new options? They now understand their doctor is no longer in the network with the plan they currently have, or isn't in a network where they have where True Choice offers a plan that has better cost and benefits for them, right? What would you say to that person that is looking at that scenario where they either need to find a new facility or doctor, or they need to, from a financial perspective, make the change to a plan that provides better benefits and cost?
Right. And that's always the key, right? Is so many people, get connected to their doctor. Um, in reality, you've got to measure. Doctors go on vacation. Uh, you know, Doctors can get pregnant and go on leave for having a child. Uh, there's so many options here that where you could lose your doctor, um, against what you want. So a lot of times, staying connected to your doctor, although it may seem like a good choice, uh, you've got to have some flexibility there. Um, because certainly, if you can find a plan where you can save significantly on that, uh, you're going to see your primary care doctor. Many people, it's maybe twice a year, um, and you're going to miss out on some other opportunities with other plans over a primary care doctor. Would your doctor sacrifice $2,000 worth of dental benefits for you to keep you as a customer? That's a no. It's not going to happen. So you've got to look at all aspects of the plans, the options that are available in your area, and realize that we certainly want you to have your doctor. We want you to, this is not a everybody needs to leave their doctor. We work with so many different plans, and the networks are out there, but you certainly want to be flexible and not be so quick to dismiss other opportunities that are out there because of a doctor that you see twice a year. Like I said, it's to give up $2,000 worth of dental because your doctor's not in the network. It's your doctor wouldn't do the same for you.
Yeah, I think that makes a lot of sense, and I hear often that someone will say, I just, my doctor's not in the network, and I want to find a plan where, they are. And then we go on to have a discussion about how often you see them, and it's once or twice a year. And I think I think you brought up a really good point, and that is, sometimes it really makes sense to go with the benefits and cost, even though that your doctor or facility may not be in the network. Most carriers offer great doctors and facilities, and contract with them. And so I think that's an excellent response. I have another question, but I saw Mom wanting to speak up.
Well, I just wanted to add to that point. In this day and age, so many doctors now use nurse practitioners and PAs. And so even though that's our doctor when we go, that's really not the person we're seeing anyway. But somewhere along the line, I guess in life, you've had an interaction with the doctor, you've had maybe a bonding moment emotionally, and there's an emotional connection. But in reality today, when we go to the doctor, we see a lot of different people in the office rather than the actual doctor that we're talking about.
Right. And that's really the key, right? Is having the, you know, being flexible enough to know that, yes, that is my doctor, but you're absolutely right on the PAs and the nurse's assistant. You're spending on a typical doctor's visit, you're probably less than 3 minutes with the doctor themselves and more with the office and the assistants. And um, so it's certainly even nurse practitioners now. So there's certainly a lot of reason to maintain a flexibility and be able to go beyond just saying, well, this is my doctor. I'm not taking a plan if my doctor's not in the network. So
So one other thing, and I want you to talk a little bit about this, and it kind of boils down to what True Choice offers versus, you know, potentially a different insurance agent or brokerage. Um, you spoke a little bit about how True Choice goes, you know, beyond the call by helping, you know, individuals find assistance when needed, and you know, True Choice doesn't get credit for that necessarily, um, and I feel like that is what really sets apart often and builds the rapport with, you know, individuals um, and the relationship that True Choice can offer. Can you talk a little bit about that and expand a little bit further? You know, I hear and I, you know, when I'm, you know, speaking to seniors or in the field or even people under 65 that are, you know, looking for insurance, they'll say, you know, I can't tell you the last time I spoke to my insurance agent. I don't even have their phone number, and I got questions, and I don't even know how to get in touch with them. What does True Choice offer that, you know, a lot of these other individuals, insurance agents, brokerages aren't offering?
so one thing is at True Choice, we're not the typical agency where they do the big hire for the annual enrollment period. Uh, and then come the end of the enrollment period, everybody's gone, and that person who you trusted to help you with their plan is no longer there with the company, right? True Choice has got their picture as they're looking for health insurance agents that are dependable and reliable and are in this, you know, to help people throughout the year. Each of the agents are given toll-free numbers and resources. I have a personal web page, a personal URL. I combined my personal URL with the domain name emedicarepros.com. That domain name, you log on there and you can see the plans. Listen, this is 2021. This whole idea of getting somebody on the phone and asking them to trust something because I tell them, you know, is coming to an end. Trust not what I can tell you, but trust what I can show you. And that's where having that website, having that emedicarepros.com, and this is not a solicitation thing. This is not a marketing scam to try to get people. This is just it's a domain name. People log in and they put in their zip code, and they're not drawn to getting calls. You know, if they go to my webpage, and every one of the agents at True Choice has their own webpage, they can look at their own and not worry about, am I going to get triggered? Is this going to trigger information that's going to get somebody on the phone hounding me trying to sell plans? Listen, I follow up with the people that want to talk about plans. There's enough people that are looking for help. And I think as an agency, we've got agents that are focused on, you know, making use of the tools and providing options to people. And it's more than just a numbers game. How many can I sell? You know, I know on a personal level, I know there's a number of people of faith that are believing that they're going to get the right people each day to speak to, people that they can make a difference in their lives. Because insurance really has that ability, unlike anything else, to really influence someone's life. Someone who's had no dental for the last 3 years because their plan didn't have it, and can get something taken care of in their mouth. You can regain confidence. You can feel better about yourself. You can feel better about going out in public. If you're able to get that crown done that you've been, not taken care of for the last couple of years. So there's certainly uh, a lot of things that they can be done. Plan features like benefits, over-the-counter benefits. That's a huge benefit. When we got plans that offer over-the-counter benefits, they get people vitamins and nutritional supplements. Incontinence supplies is a great one. I love sharing that with the customers. Transportation is a great benefit that's available in so many of the different plans. People don't even realize it, but these plans that could actually get you back and forth to the doctor. I don't know how many people I've spoken to over the last year that don't go to the doctor because they can't get to the doctor. And for me to offer a plan that has transportation and say, look, I don't want you trying to find a city bus to get to the doctor. I want you to be able to call the plan and say, I need to get to the doctor, in 3 days, and you schedule it in advance, and they show up and they take you there. I have a local woman in my community I helped just a couple weeks back that she's in her 90s, and she was telling me about taking the city bus to her doctor's appointment. It scares me to think that there's people out there that didn't have the benefits that were available for that. And so, that's really the key.
Donald, I think that is a key too. I love all the extra benefits. One thing that I find challenging for IGOT communities members, especially the older population, is once they get their packet from whatever insurance carrier that there is, there's steps they must take once they get the package to get signed up for those extra benefits. They get
Right.
they're theirs, but you have to make phone calls. And in a lot of cases, it's telling you to go online. They don't have internet. So one of the things that we love to do at IGOT Communities is when True Choice, it's why we partner with True Choice, is when they can find a plan that's really customized just for that individual, then we try to follow up with those people and say, okay, when you get your packet, give us a call and we'll come. And, so I've helped make lots of phone calls to get them for their transportation, or, for gym memberships, just all kinds of different things. And it is important. There's more pieces to it. And as you age, it gets a little more complicated for seniors to navigate that in their brains.
Right. And then, like I said, I'm mentioning aging, right? I'm turning 55 today, ready to join IGOT Communities here for you. Is we've got to realize that there are different things, and we've got benefits. It's very common now in Medicare plans to have a personal emergency response system. That's one of those push buttons, but it's not going to come in the welcome kit, right? You've got to sign up for that, and that's the key, in having one, either the knowledge and ability to follow up on your own, but to have a resource like IGOT Communities, where you can follow up and make sure. Listen, there's so many different benefits to take advantage of, and having someone there to help walk you through the benefits, help you to understand that, yes, look, you're entitled to this emergency response system. Let's get this set up. Let's get this shipped. Let's get your monitoring set up. And there's no charge for monitoring when it's included in the Medicare Advantage plans. So, I talk to people every day. I'm like, oh yeah, I've got one of those. I saw the commercial on TV and I signed up for it. I said, yeah, you're paying a monthly monitoring fee. I said, the plan, and I see it in the anthem plan. I said, the plan realizes that if they're responsible for your health care, it's going to be more cost effective for them, for you to get the help as soon as possible, not lay on the floor for 2, 3, 4 hours. So they want you to have that, even at the cost of the monthly monitoring. They want you to have that type of system, that type of response system, to know that listen, our customers, our members are going to get the need they need, in an emergency as quick as possible. So it's a great benefit. It's a great feature to be a part of the plans. Listen, as you age, you run into, I can't do the same things I could do 20 years ago. And, it only goes backwards. So at some point, uh, when you've got plans offering things like a personal home helper that is coming to assist you with chores, with laundry, with, cooking or cleaning, I can't wait to get there where someone's going to come and do my ironing for me. I don't want to, but whatever needs to be done, there's planned features that are for that.
Mhm. Kim, welcome, and thanks for joining us. Do you have any questions yourself that you want to ask about Medicare, Medicare plans? I know that.
Wondering, is there a dollar amount nest egg? What do I want to say here? Limit that you can't get in. My friend, I was telling Debbie about my friend. He says, "Oh, I can't get any of that because of my savings."
All right. So
Yes, Donald, will you address that? You've already told me that, but would you address that with me?
right, sure. And so one, a Medicare Advantage plan, there's no limitations on the Medicare Advantage plan side. It is open to enrollment for the same cost for everyone, regardless of their income, regardless of their age, regardless of their gender. A Medicare Advantage plan advertises cost in a zip code, and that is the same cost that everyone pays. Now, in terms of your Part B premium, I've got some stats here. Let me see if I can find that Part B premium. A Part B premium can vary based on your income. Part B beneficiaries. So again, everyone's, as long as you've worked the 40 hours or 40 quarters, I should say, not 40 hours, 40 quarters, so equal to 10 years, you get Part A at no cost. The Part B the typical person is paying $148.50. But there are some income limits, an income limit of, and I believe it's a single income limit, 88,000 per year, 111,000 a year, 138,000, 165,000, or 500,000. Your Part B premium could change from 148 to 207 to 297 to 386 to 475 or to 504, which is the maximum anyone would pay for a Part B premium. That would be someone that's in that greater than $500,000 per year that would be paying $504 a month for their Part B premium. But that same Part B, whether you're in the lowest level of income or the highest level of income, makes you eligible for Medicare Advantage plans and the benefits that are available through Medicare Advantage plans. And there's no restriction. You can still get over-the-counter benefits. You can still get dental and vision. It's just a matter of what you choose, what's going to be the right fit for you.
So Donald, in her situation with her friend, I have a little bit of prior knowledge on this. He is talking specifically about the extra help. And so would you address those hard limits that you addressed earlier for her, to tell her about his annual income and his assets?
Right.
I'm
And
just going to tell you, when his wife died unexpectedly, he didn't know she had life insurance and stuff. So he got a good chunk of change. And so he paid off whatever bills, gave some to the kids, and he's got a little nest egg. Okay, he works at Crane, which makes toilets over here in Somerset, where they close now, but he worked there for 37 years. So he gets his Social Security. He's 75. He just turned 75. He gets his Social Security Plus, he gets a pension from Crane. And he was just, when I told him about how Debbie, Debbie, you helped me, he goes, I won't be eligible because I make too much. I draw, well, he calls it draw. He draws too much. So
Right.
that's my question is, is there a limit?
Yeah, so the extra help for prescription cost has two limits. There's the whole thing can be summarized in two questions: what's your income and what's your assets? The income is based on federal poverty levels up to 150% of the federal poverty level. That changes in February or March of each year. So right now, a single person, $19,140 per year. So let me pull that up.
19,000 what?
$19,140 per year. We divide that by 12 if your monthly income is greater than $1,595, and that is Social Security and any pension, any source of income. If it exceeds that, you're not going to qualify for the extra help program. The other part was the assets, and again, for a single person, it's $14,610.
So
It doesn't.
if he has in savings left from that life insurance policy, anything greater than the 14,000, whatever that number was,
Yeah, 14,610.
he would not qualify.
Yeah, I think that threw him out of the ballpark.
Yeah.
Okay.
Yeah.
Right, and it's
Thank you.
so that program is to help pay for prescription costs. There are other programs. They're called state pharmaceutical assistance programs. I'm not sure. Let me take a look. What state is he in?
Kentucky.
Kentucky. Let me take a quick look and see if Kentucky has any state pharmaceutical assistance programs. They usually would have different income levels. No, it goes from Idaho to Montana. No case. Okay. So yeah, different states have these programs available, but I'm not seeing one in Kentucky. So yeah, it's not. So he's able to get all the benefits of Medicare Advantage, but when it comes to this program to help limit his costs, his expense on prescriptions, he's not going to qualify for that. And it's unfortunate, because I've seen it in many times. It's that exact same scenario where a couple is on extra help or even Medicaid, and one of them may have a small policy, and something happens to one, and suddenly there's a little bit of money, and it blocks them out. One thing I would say is, that number is going to vary a little bit from year to year, but if the asset limit is the 14,610, over time that money gets spent, the money that's put him over there. And so it's not bad to check in every year, every two, and see, have you, has your spending put you below that limit? Are you now available for it? Just looking at, different ways to put it in, things like life insurance policies, burial plots, irrevocable burial contracts are things that aren't counted in the assets. So if he takes some of the assets that he has and transfers them into things that don't count, right, that wouldn't count towards assets. So if he were to take care of paying for all his funeral expenses in advance, so that's not a burden on his child, that then becomes income that's not counted as an asset. They're not going to count that he's already carrying his burial contract, his plot. All of those things can all be paid for in advance and not have any holdings against it. Personal possessions are not counted. Vehicle, the vehicle that you drive cannot be counted. But certainly there's two sides to that too. One is it's good to have a nest egg, right? You want to have something to fall back on. So it's unfortunate that it's kind of a one or the other there, but if you're if his medications are at a point where he can't afford them, then that may be something he would want to try to address, maybe at this, the state Medicaid office, or see if there's something, anything that they've got, any type of programs, even local programs, that can help.
And he got on that, whatever that supplement thing that they got right now, what you were saying, the Medicaid or
Medicaid.
Yeah,
Mhm.
he's got on that, and that's been paying for what medications he's been, that he takes.
Right. And so everything that I said about these numbers are superseded by the state's Medicaid program. So these are the federal levels to qualify for extra help. But also with the extra help program is you're entered into the extra help program at the state level if you qualify for Medicaid in that state. Because a federal poverty level, even though it's a set number, in California, the cost of living is higher, right? So somebody's going to qualify for assistance through the California's Medicaid program at a higher income level than these numbers. And so because they qualify for the state Medicaid program, it supersedes the federal guidelines here and gets them enrolled into the extra help. So the extra help can be overridden by qualifying for the state Medicaid program. So if he's getting some type of assistance from the state, he may be able, he may already be getting that assistance through the extra help program as well.
Yeah. Donald, we have only about 12 minutes left, 11 minutes left, but just briefly, could you describe if someone has an F plan or a G plan, and let's say they're in their late 80s, early 90s, and now they're paying a whole lot of money, up to $344 a month, sometimes for the plan. When do they know it's time to go to a Medicare Advantage plan if financially it doesn't make sense to keep an F or a G?
Right, and that's a great question. And I kind of did a comparison. So many people, get locked into their F plans or this mentality of the Medicare supplement. There's a lot of people that have been on Medicare supplements before Medicare Advantage existed. So they never really knew about that as an option. It's going to come down to your costs. It's going to come down to your quality of life. If you're paying all of your, too much of your money out for your Medicare supplement plan, and there's Medicare Advantage options that are out there, I talk to people every day, and I will analyze their situation. That's the whole key, right? There's not going to be a clear answer. What do you need to make to make the decision? It comes down to talk to a knowledgeable licensed healthcare agent like we have at True Choice that can review your options and see, because I'll talk to people, and one of the deciding factors that I use for somebody that's considering leaving a Medicare supplement is going to be, what are you paying each month? I multiply that by 12, and I will compare that against a maximum out of pocket. Because listen, I'm here to help people, and we've got there's a commitment as a health insurance agent that you're going to work in the customer's best interest. And so with that, when I find somebody that's paying $300 a month, they're $3,600 out of pocket just for the plan, and then they're paying another $40, $50 a month for their prescription plan. If I can find them a Medicare Advantage plan that's going to cap their maximum out of pocket at $2,500 or $3,000, and provide prescription coverage, that's going to be the key, and that's going to vary by market, and that's where you've got to look at it and see, because not every plan is going to be the right fit for somebody coming out of a Medicare supplement. Because the last thing, I'm not going to feel good if somebody gives up an F plan that they were paying $300 a month. Oh, I helped them. I put them into an advanced plan. I got them dental. I got them vision. Listen, if that person has a rough year, they're in the hospital 3 times, and at the end of the year, they hit a maximum out of pocket of $6,500. What have I done to that person? I've cost them $3,000 out of pocket. So having that individual review, individual assessment with the Medicare licensed agent, like we have at True Choice here, is going to be the key.
I agree with that. And it's one of the reasons why we stay so connected with True Choice, because there have been many times that I've been helping with assistance because of hearing or comprehension. And I've heard True Choice say, you have the best plan you can get. And that means a lot to me as somebody working with senior adults, that their best interest is protected. And so that's one reason why True Choice means so much to us. And so I really appreciate all that you all do. Another thing that we've loved so much about True Choice is being able to get on the phone with you, and it just seems like we can understand you. You all talk with a lot of patience. You talk slowly. You're very kind to our seniors who call in. They can understand your accent. All of that's important, because these applications sometimes you could be on the phone with you guys for an hour, and having somebody that you feel like you can say, can you hold on? I have to go use the restroom, or I have to take a break, or I need to do something. I just can't say enough about the quality of care that you've given to our membership. I really appreciate that.
And we thank you. We certainly appreciate having you as a valued partner, and we, as a whole, I know many of the agents have worked with you and enjoy working with your customers, your members there at IGOT Communities. And the key to our continued success is being there and able to help your people. And to provide options that are meaningful, that are going to really, because you're there to help them transition, help them to find what's working in their best interest. And I remember specifically over the enrollment period, we did a couple customers that we reviewed their medications during the annual enrollment period to see if a Part B plan was going to be a right switch for them. And at the end of the conversation, I put in all their drugs. I did everything that I did. And the end of my conversation was, I'm looking at the best plan that I've got for you. And I've got many. I've got so many different companies now, between Aetna, Cigna, Humana, United, WellCare, Centene, Allwell, Mutual of Omaha. And to come back to the end of it and say, take a moment and go back and review this on Medicare.gov, because I think you might find something there that I can't offer you that's going to be beneficial for the customer. Listen, we want to work in your best interest, and at IGOT Communities, it's not. I want you to be able to help your customers the best that you can, not the best that I've got to offer you. I want you to be able to provide for them in the best way. And that's where a trusted partnership comes, in knowing that we've got your back, and we know that you've got the back of your people.
Thank you. Well, thanks for your time today. Thanks, Kim, for joining us, and Chris.
Hey, Kimberly, have a question?
Yes, I was just wondering, on the commercials, they say you could get your $144 put back into your Social Security. How does that work?
Sure, absolutely. Listen, that's everything that you see on a commercial. And this is a great point. Everything you see on a commercial, unless they specifically name one plan, and this this is paid for by Humana or paid for by Anthem. If they are not mentioning a plan, the chances are it's a marketing company pulling the best benefits and features from all the plans across America to try to draw you in and to draw interest. Listen, save the trouble, go right to True Choice. Give us a call at True Choice. Chris, what's the direct number for True Choice's line? You know it
Mom
offhand?
hasn't memorized.
Yeah.
The IGOT Community's direct number.
Oh, okay. Do I have it memorized? No, but I will tell you.
Okay.
Hold on,
Well,
I'll tell you exactly what it is.
listen, call me 855-342-3366.
855
342
342.
3366. Call me directly, because what that is, that's a marketing ploy to get people interested in what are the features. The bottom line is your features are going to vary from state to state. They're going to vary from county to county. That $144, it sounds great on the phone. You know, I could put in your zip code and look in just a moment and see if any plans are featuring that. That plan is most commonly connected with not the plan paying it, but the state Medicaid program paying for it. Most people that are getting the full $148.50 back, it's being paid for by your state Medicaid program, not the plan. Now, go
That's
across the
the
country.
extra help. That's part of the extra help that, depending on your level of help that you get from Medicaid, that is where that 144 is coming from, is from a portion of Medicaid based on your income.
Right, Medicaid savings program that helps pay for that that Part B premium. But across the country, there are some places where I might find $50, $25. I'm in South Florida. I can tell you South Florida is one of the most competitive markets. I was looking at it with a customer this morning. I see a 120, I see a 100, I see a 90. Go to California, you'll find the same type of numbers in Southern California. But in Kentucky, give me your zip code. I can look.
42501.
Just waiting on the system here.
I mean, I'm thankful I don't have regular television, but I go over to my friend's house and I tell you, when the commercials come on, it's like 3 different 1-800 numbers. And it's just like, and they all say the same thing. You could get your $144 back, but it's a different 800 number. And it's crazy.
So
Yeah.
Kim, I'm going to go ahead while he's looking for that and tell you the True Choice number straight in to the IGOT number for True Choice is 855 511 6319.
Okay. True Choice.
And Kim, if you were to call Don's direct number, Don is he is one of the top selling agents for True Choice. He and the rest of the agents also know how to make sure that IGOT members are recognized, and IGOT would get credit no matter if you called Don directly or if you called the IGOT direct number.
Okay. Thank you. Well, that one lady did help me. I was very, she was very, very helpful and nice and everything.
Yeah.
Can't remember her name. It was an unusual name.
That is one thing I can say about calling True Choice is whoever you get absolutely treats you with such professionalism, knowledge, and dignity. And
Yeah,
it's
a joy to work here. It's a joy to. What's the zip code again?
42501.
And I'm going to look quickly here. For Part B givebacks, WellCare Dividend has a $75 Part B giveback. That is the only one. So WellCare. And WellCare, as of this week, is part of what True Choice has to offer. We've been in the process with them since October. Chris knows, probably behind the scenes well before October, but everything was just finalized for them, and they are offering a $75 Part B give back in your zip code. And then you look at the other features of the plan to see, does it make sense? Because a Part B give back is just one aspect of the plan.
Exactly.
Typically, I would tell people if you're getting a Part B give back, expect higher co-payments at the doctors. You know,
Okay, yeah.
it's a trade-off. They're giving you
Yeah.
that. Those plans generally work well for someone that doesn't use a lot of healthcare coverage, to, you know, to get them, you know, at least have coverage, get them back part of their Part B, but they're not using a whole lot of healthcare coverage. Someone that finds themselves at the doctor more often or taking more medications, you know, you're probably going to be more suited with a plan that has lower co-payments. And that $75 a month, 750, $900 over the course of the year, you may end up spending that in added healthcare costs, in other features, in other ways. So you certainly want to make a, you know, use wisdom and discernment in choosing your plan, and review it with a professional that's able to review all the options for you.
Well, I mean, I've been on getting my Social Security for 2 years now, and you know, I've got it budgeted out. So I mean, I'm happy about it. I mean, I know that there was a catch. You know, I mean, it just sounded too good to be true.
Right, and like I said, it's a draw line. It's a marketing company, and why not just come right to the source? Because what happens with those marketing companies is they're selling the information to multiple companies. Your phones are going to get bombarded. It's almost like a bait thing where to see who's going to bite, and then they're out telling everybody, you know, your information, and you know, you're getting lots of calls. Come right to True Choice right from the start. Avoid, you know, getting bombarded with multiple companies calling you and getting transferred around, and just go right to True Choice. Get the, you know, an agent that you know is going to be able to have multiple options, you know, fairly assess your needs, and see, give you, you know, a fair answer. Is this better for you or not? So.
I appreciate it.
Well, thanks, Dawn, for your time today, and I hope to have you on again throughout the year at different periods
Pleasure.
when things are going on. Thanks, Chris. Thanks, Kim, for joining us, and we'll make this video available to all of our members.
All right, a pleasure. Thank you again for having me, and wish you all the best with IGOT Communities there. And we'll be in touch. I have to be in touch about getting signed up now that I'm 55.
Okay, thank you so much.
All right.
Bye-bye.
Bye-bye.